starting with diabetes and related autoimmune disease. Je m'appelle Dr Hamoun. Il arrive. On le laisse en dernier. Donc on passe à Amal Moumen, qui va nous parler du diabète néonatal avec des mutations spéciales qui ont été décrites chez un enfant très très jeune. Merci. C'est le service de pathologie endocrinologique de l'hôpital d'enfants de Rabat. Un travail dirigé par professeur Imenzine qui s'excuse, il n'a pas pu venir.
Donc, hello everyone. I'm very happy to present you a case report about early onset diabetes with homozygous LRBA mutation, the youngest patient reported. Type 1 diabetes is a chronic autoimmune disorder characterized by an absolute insulin deficiency caused by the destruction of pancreatic beta cells. Although a significant number of types of type 1 diabetes patients have or will develop further autoimmune disorders during their life. However, the coexisting severe immunodysregulation is rarely seen in type 1 diabetes patients. A number of novel monogenic conditions with severe autoimmunity and immunodysregulation that became clinically symptomatic already in early infancy have been described during the last decade. We report a homozygous nonsense mutation in LPS gene previously implicated as a cause of common variable immunodeficiency in two brothers presenting with the diabetes type 1 and severe immunodysregulation. In addition, our patient is the youngest reported case. Patient 1 was born in non-consanguineous Moroccan parents. He was followed in our department for diabetes since the age of 1 year and 3 months. Ketoacidosis was the first presentation of diabetes. Diabetes-related antibodies were not done. However, given the age of and the mode of discovery, we retain the diagnosis of type 1 diabetes, and the patient has a good glucose control with the human insulin. In addition, our patient had a chronic diarrhea of unclear etiology since this age of 1 year. Duodenal biopsy showed no specific jejunitis. Results of serological tests for celiac disease were negative, and diarrhea persisted despite period of gluten-free diet. His history was also remarkable for autoimmune thrombocytopenia at 3 years of age. The bone marrow biopsy was non-specific, and he was treated with multiple courses of corticosteroid. The association of type 1 diabetes, chronic diarrhea, and autoimmune thrombocytopenia led us to suspect immunodysregulation, polyendocrinopathy, enteropathy X-linked, but the analysis of the FOXP3 gene did not identify pathogenic mutation. Furthermore, our patient had lymphoproliferative syndrome, including hepatosplenomegaly, cervical and inguinal lymph nodes. The lymph node biopsy was normal with reactive adenitis. During the evaluation, it was noted significantly barring insulin dose requirements. Our patient died at the age of 6 years and a half by hemorrhagic shock. The patient 2, the younger brother, was hospitalized at the age of 45 days to emergency service due to polyuria, polydipsia, and tachypnea. His birth weight was 3 kg. He has no history of recurrent infection, diarrhea, or autoimmune hematologic manifestation. Laboratory investigation was consistent with diabetes ketoacidosis, and diabetes-related antibodies were not done. Following the appropriate treatment of diabetes ketoacidosis, he is now aged 1 year with acceptable glucose control. Early onset of diabetes in the younger brother, the age of 6 weeks, guided our attitude to neonatal diabetes. So mutation analysis of all known genes and of neonatal diabetes seemed to be the appropriate diagnostic tool to screen for autosomal recessive mutation, which might explain the clinical manifestation of the two affected brothers. In that, the analysis of the coding region was performed. After filtering data intersligni, the LRBA homozygous nonsense mutation was found in patient 1. Direct Sanger sequencing confirmed the LRBA mutation in the family. Patient 2 was the only other family member carrying the mutation at the homozygous stage, and as expected, both parents were heterozygous for the same mutation. The LRBA have been first described in 2012 in 5 patients presenting with hypogammaglobulinemia and variable feature of autoimmunity, including autoimmune hemolytic anemia, autoimmune thrombocytopenia, chronic lung disease, and autoimmune enteropathy. Since then, 30 further cases with LRBA mutation were reported. The LRBA protein function is not fully understood yet. It seems involved in endocytosis and polarized cytosolic trafficking during activation of the B lymphocytes. The clinical features observed in patients with LRBA deficiency are heterogeneous, with age of the first manifestation ranging from 2 months to 12 years. The majority presented at or before 5 years of age. In our 2 patients, the first manifestation, which is in both cases diabetes, appeared before the age of 5 years and the age of 15 months and 45 days, respectively, in patient 1 and patient 2. The disease phenotype can broadly be divided into enteropathy phenotype and autoimmunity phenotype and immunodeficiency phenotype. The clinical phenotype for our index cases comprises mostly autoimmune manifestation, namely the diabetes type 1. In fact, autoimmunity affects in 25% of patients with LRBA mutation during their life. In our 2 patients, autoimmune feature revealed the disease. In patient 1, diabetes type 1 was diagnosed at the age of 1 year and 3 months and 45 days for the patient number 2. Normally, only 7 reported LRBA deficient patients suffered from the type 1 diabetes. Yet, to our knowledge, this is the first description of neonatal diabetes associated with the LRBA deficiency. Patient 1 presented a recurrent respiratory tract infection. However, immunoglobulin level was normal and hypogammaglobulinemia described at the first patient by Lopez Herrera was observed in our patient. The patient 2 had also a normal immunoglobulin level. Similar to the phenotype of our 2 patients, high heterogeneity of clinical presentation can be observed in patients within the same family, especially regarding autoimmune symptoms with non-clear genotype to phenotype correlation. A very promising therapeutic approach is the abatacept, because of the abatacept and the hematopoietic stem cell transportation seems to be the therapeutic option for the LRBA deficient patients. To conclude, we report a new LRBA mutation identified in 2 brothers, confirming the substantial variability of the clinical presentation in LRBA deficient patients even within the same family. Although the diabetes type 1 was reported in only few patients with LRBA mutation, our observation illustrates the youngest reported case with LRBA and diabetes. And thank you.